Welcome to Community Health Heroes, where we spotlight local leaders and organizations that provide much-needed health and wellness resources and information. Our hope is for everyone in our community to strive to live healthier, happier, and longer lives. I'm your host, Leslie Snedowski. Thank you for joining us. Do you want to live a healthier life? Do you feel like you need to detox and lose some weight? And do you need some help building up your immunity to get stronger? The Urban League of Louisiana is hosting a 4-part empowerment series in May called Get Well Now. Davlin Marshall, the founder and lead personal trainer for Drive Sports Performance and Marshall Medical Group, will give us a preview of the 3 sessions he'll be leading. UnitedHealthcare is confronting the opioid epidemic at every opportunity and from all angles. Dr. José Calderón-Abbo, Chief Medical Officer for UnitedHealthcare Community Plan for Louisiana, will be here to tell us how UnitedHealthcare is partnering with care providers and communities and using powerful data and analytics to prevent opioid misuse and addiction, tailor ways to treat those who are addicted, and support long-term recovery. UnitedHealthcare has also announced a new way to help improve people's smiles and save them money. More than 1.5 million UnitedHealthcare dental plan participants can now purchase clear aligners from SmileDirectClub for less than $1,000 out of pocket, offering improved convenience and significant savings for orthodontic care. More about this new partnership in our Community Health Heroes report. And in the kitchen, owner of Reginelli's Pizzeria, Chef Darryl Reginelli, and Operations Manager Adam Carey will be joining us to prepare their popular strawberry field salad and tell us about their new menu that features additional Eat Fit approved dishes, including hummus and select sandwiches. So don't go away. We'll be right back with more Community Health Heroes.
It takes less than 1 minute to find out if you may have prediabetes, and you can do it here. So what are you waiting for? Just go to the site.
Welcome back to Community Health Heroes. Did you know that throughout the month of May, the Urban League of Louisiana will be hosting a 4-part empowerment series called Get Well Now? These free seminars will focus on adopting a healthier lifestyle, losing weight, healing, and building immunity and strength. With us now to tell us all about how health and wellness changes lives and empowers communities is Davlin Marshall, the founder and lead personal trainer for Drive Sports Performance and Marshall Medical Group. Davlin, we're so glad to have you here today. Thank you for joining us.
Good. Thank you for the invitation.
I know the Urban League is focusing their empowerment series this month on health and wellness, and you're the star. You're doing 3 of the segments.
Yes, I am.
Can you tell us a little about, first of all, what you do with Drive Sports Performance?
Okay. Yes, Drive Sports Performance is a fitness and wellness company. So what we do is we offer coaching, consulting, as well as training. So in the fitness world, there's there's personal training, there's small group personal training, and we work with athletes, and we also design and provide programs for small and larger companies. So if they want their employees to get in shape or get fit, of course, we can design a corporate wellness program as well.
Well, for the whole month of May, the Urban League is focusing on health and wellness. And like I said, you're going to be doing 3 of the seminars. I wanted to talk about the first one, how to adopt a healthy lifestyle. That sounds a lot easier than it really is, right?
So what I'm going to try to do is, teach techniques and show different people, everybody goes through it, number one, and you just have to get people to understand that it comes from a place of self-care. So you have to teach and coach that self-worth is really, really important before you start making positive decisions. And sometimes you just start with one really simple decision and then you just start to build on it. And before you know it, a lot of those bad habits that we have, we can erase them. And the healthy lifestyle just becomes part of what we do on a normal day-to-day basis.
Definitely good advice.
Right.
But I also want to talk about your second seminar. This sounded very interesting to me. It's about losing weight, but also detoxing.
Right.
That sounded like there's something going on there. Tell us about that.
Well, the best strategy is picking organic and healthy foods first of all. Some, like spinach, cabbage, things that have very, very high in fiber. We can ingest and eat these foods, and what they'll do is they'll actually help our body remove toxins.
So they act as natural detox agents.
Exactly. So things like that. There are tricks like going from sympathetic nervous system into your parasympathetic nervous system. Well, we can actually turn our bodies off a little bit so that it can rest and recover. So if you're taking a shower and you go from a hot shower into a cold shower, that'll actually do wonders for your body, and it helps it recover, it helps it rest, and it helps it remove toxins as well.
Gee, you learn something new every day. That's interesting. I do know the third installment of the series, Dr. Denise Shervington is going to be holding that one, and that's about healing. But the fourth one is about, and this sounded really cool too, the one you're doing is building immunity, vitality, and strength for life. How do you build a better immune system?
So what happens is we're actually teaching and training the body to heal itself. So once you have more of a clean slate and your body's performing more efficiently, the things that you're doing in order to get to that point, of course, are going to be things like exercising, you're making better decisions, and you're going to start to turn back the hands of time. You're going to look younger, your skin's going to look great. So when in the beginning of this, when you didn't feel like you had energy, now all of a sudden you're filled with energy. So again, what happens then is you have better interactions with your friends, with your peers, and life is great at that point. But it's very, very tough to feel positive. It's tough to feel strong and confident if you know that, well, you may not know it, but if your body's just filled with toxins, and maybe it's the toxins that are, getting us to feel the way that, not optimal.
I know the Urban League is focused on changing lives and empowering communities. Do you think through better health and wellness habits you can do that? Oh,
definitely. And we live in New Orleans is such a city with a great culture. And I like to think that if we didn't really indulge in all of our comfort foods so much, that we could actually use them as reward. But I think that the Urban League is actually doing a great thing in offering these empowerment series to the community, especially for free. So you can't beat that. Yes,
the seminars are free. Yes. I'm glad you mentioned that again. Davlin, tell us how our viewers can learn more about Drive Sports Performance and Marshall Health Group.
Well, all of our information is online. We have a website. It's drivesportsperformance.com. And again, all of the information is there.
And and your seminars will be held at the Urban League. And what's that address again?
It's 4640 South Carrollton.
Excellent. Yes. Great. Well, thank you so much again for joining us. And good luck this month.
Appreciate it.
Good luck with all your seminars. Hope a lot of people attend.
Thank you.
When we return, the opioid epidemic and a doctor who will tell us about alternative treatments to help people deal with pain. We'll be right back.
Some things in your medicine cabinet are more dangerous than others. When it comes to prescription drugs, opioid pain medicines can be addictive and even deadly. Keeping unused opioid medicines in your home is risky. Half the people who misuse prescription pain medicines get them from a friend or family member. Over 100 Americans die every day from an opioid overdose, and millions are addicted to opioids. But you can be part of the solution to the opioid crisis. Go through your medicine cabinets, drawers, anywhere you keep unused opioid pills, patches, or syrups, and find out how to dispose of them safely. Visit fda.gov/drug disposal for details and remove the risk of opioids in your home.
Did you know that every 13 minutes someone dies from an opioid overdose? 2.1 million people have an opioid use disorder, and 80% of the world's supply of opioids is consumed in the U.S. Our next guest, Dr. José Calderón-Abbo, Chief Medical Officer for UnitedHealthcare Community Plan for Louisiana, has pioneered whole-body approaches to behavioral health in Louisiana and is currently developing a mind-body medicine model for addiction treatment. He joins us now to talk about the opioid epidemic in New Orleans and throughout the state. Thank you for joining us today, Doctor.
It's a pleasure. Thank you for having me.
And we'll be talking about a very serious topic, especially in Louisiana, about the opioid epidemic. How bad is it in the state?
What happens in Louisiana, this is data that we have from for America's Health Grades. That's looking the data from 2007 onward, and that we've seen a 46.5% increase in accidental drug overdoses in the state of Louisiana. And most recent data from the Louisiana Department of Health is estimating that we have about 105 prescriptions for opiates per 100 citizens. So that means that we have more prescriptions for opiates per citizen in the state of Louisiana. That's hard to wrap your head around. Yes, particularly considering that most people begin their addiction to opiates with a prescription, right? Or through their prescription, somebody else's prescription.
But I know UnitedHealthcare is trying to combat this epidemic, and one concrete example is something going on in Baton Rouge, which is what's called the GRACE program. Can you tell us a little about that?
The GRACE program is particularly tailored to address the needs of expecting mothers and their children. So aspects of stigma, of early diagnosis, of case management, referring to proper treatment, medication-assisted treatment for them and their children, has shown better outcomes. So we're very excited to have this program with them.
Well, it sounds like a good way to start stopping the cycle of opioid abuse, but I know there's other ways to do so, and I know it's one of your expertise in terms of alternate treatments to deal with pain. I mean, a lot of people in America deal with pain and they need help, but I know that opioids isn't always the right choice. Could you tell us a little about some alternate treatments that you recommend as a doctor?
We need to align the expectations, use non-steroidal medications, and in cases for chronic pain, there's growing evidence for physical therapy and chiropractors, for example, to use, right? And then there's mindfulness too that people can access through apps and in other ways.
And there's also, of course, different therapies. Like you can even incorporate yoga, and even hypnosis, right? That could help pain.
Yes, guided imagery, hypnosis, absolutely.
And talking about dental work, I read some interesting statistics that most young people first get introduced to opioids through dental work and orthodonture and wisdom teeth extractions. And at that young age, I read that if children get exposed that early, their likelihood of taking opioids in the future triples. I mean, that's pretty startling, and I know it's also something that UnitedHealthcare is taking pretty seriously, right?
Yes, 10% of prescriptions for opiates in the country come from dental health procedures, but in the teenager and young adult, it's almost half of the prescriptions come from dental procedures. And we know that after 3 days, the brain begins to change. Young adults and teens, 19 years and younger, not to prescribe more than 3 days. But first and foremost, use non-steroidal anti-inflammatories as the first line of treatment.
That sounds like a lot of common sense, and I also know that there's another push for, in addition to the public awareness, producing TV and radio spots too. That's something that UnitedHealthcare is advocating for, to spread awareness. Is that right?
They are at the forefront of educating the public and providers, communities about the opioid use and alternatives that we can use, and best practices and what is needed. So they also do service in communities to see what are the barriers that we're having in this particular community, and then forwarding initiatives through education for the public. So that's very exciting.
But I know we were talking about treatment plans, and sometimes you say that you feel that some people are trading in one addiction for another. Could you talk a little about that as well?
Yeah, so that's a huge misconception. These medications are life-saving, and they stop the cycle of use and withdrawal, and the cycle of incurring in illegal actions, and the risk taken that takes place procuring street drugs, right? There are many people that are dying from accidental overdoses, from tainted heroin with fentanyl and other drugs. And so when somebody's prescribed this medication, all of that cycle stops, and they can now stabilize their life and engage in treatment and begin to engage in a journey of recovery.
Well, I'll tell you, that's very inspirational, because I know a lot of people who have this problem. There's so many impediments to getting better, and you've actually made it sound like there's some solid pathways to get help, and help is not only attainable, but it's a goal and it can be achieved. So it's very inspirational. And
may I just say a couple of things to this regard, which I think, so the abstinence model for opiates is not the standard of care, and the risk of withdrawal, or the risk of going back into use, is 60 to 80%. And the risk of dying is huge from an accidental overdose. So it is life-saving to get into medication-assisted treatment. And one last point I want to make is the distribution of naltrexone kits. Naltrexone is a medication that's an antidote for opiates, for opiate overdoses. So reverses an opiate overdose. And so the more we can put them out there, in the state of Louisiana, you don't need a prescription. You can go, any one of us can go to a pharmacy and request an naltrexone kit and get the education about it and use it. And for every 20 that we put in the street, the American Society of Addiction Medicine estimates that we save in one life. So if we are prescribed opiates ourselves, our loved ones, or our friends, it's best to have an naltrexone kit available because we don't know when that can be used and can save somebody's life.
Oh, that sounds like it's a pretty good ratio that
Yes.
to be able to help so many people that way. Well, again, Doctor, thanks for spending some time with us. We really appreciate it.
Thank you so much for having me.
We'll be right back, and our Community Health Heroes report is sure to make you smile. We'll tell you why.
Opioid dependence can happen after just 5 days. Know the truth, spread the truth.
Did you know SmileDirectClub and UnitedHealthcare's new network relationship is among the first instances of a dental plan specifically covering, on an in-network basis, teledentistry and direct-to-consumer clear aligners, a care model pioneered by SmileDirectClub to improve access to and affordability of orthodontic care. SmileDirectClub connects people with a state-licensed dentist or orthodontist to remotely review and prescribe a personalized treatment plan, monitor progress, and eliminate the need for an in-office checkup, providing a convenient and cost-effective way for consumers to have their teeth straightened. How all this works and how you can improve your smile in this Community Health Heroes report. Everyone deserves a smile they love. SmileDirectClub got to the root of the problem and created cutting-edge platforms and technology for doctor-directed, at-home aligner therapy. And people enrolled in most UnitedHealthcare employer-sponsored and individual dental plans with orthodontic coverage can now purchase SmileDirectClub's clear aligners for, in most cases, less than $1,000 out of pocket, helping plan participants improve their smiles through teledentistry and potentially save time and thousands of dollars on orthodontic care.
When you get those teeth looking like you want them to look, you want people to look at them. I mean, they're just beautiful. So what else can I even say about it?
I was so excited to know that there was a company that was number one, affordable, and number two, so convenient.
It just brings me confidence, happiness, and I love myself more.
You can go to SmileDirectClub.com to order an impression kit or schedule a 3D digital image at any of SmileDirectClub's more than 235 Smile shops across the country. SmileDirectClub then sends you invisible aligners and connects you with a state-licensed dentist or orthodontist to remotely review and prescribe a personalized treatment plan, monitor progress, and eliminate the need for in-office checkups, providing a convenient and cost-effective way for consumers to have their teeth straightened. SmileDirectClub reps say clear aligners work best for people 12 and older with all adult teeth and mild to moderate crowding or spacing issues. Tom Wiffler, the CEO of UnitedHealthcare Specialty Benefits, said UnitedHealthcare's new relationship with SmileDirectClub enables more people to improve their smiles, helping encourage them to make a greater commitment to their dental health. Research shows oral health is connected to overall health, so working with SmileDirectClub helps further meet our dental plan participants' oral health and whole health needs. And here are some numbers to smile about. More than 500,000 smiles have been transformed by SmileDirectClub staff of more than 4,300 since 2014. It takes about 6 months to straighten your smile, and customers save about 60% of the cost of traditional procedures. In New Orleans, there's a SmileDirectClub located at 650 Poydras Street in the CBD. SmileDirectClub also offers Bright On premium whitening products and solutions. For more information, go to SmileDirectClub.com.
Does your family need a break from the daily routine?
Hello, I'm Dr. Spruce. If you or someone you know needs a healthy dose of nature, visit discovertheforest.org and trade in the big screen for the big blue sky by visiting a local park or forest near you.
Hiking, picnicking, swimming, orienteering, climbing, admiring wildlife, or inhaling fresh air may result in heightened creativity, feelings of joy, harmony, satisfaction, and a euphoria that can only be explained as oneness with the natural world. Whoa.
I'm Molly Kimball, registered dietitian and founder of Oxner's Eat Fit NOLA. We've collaborated with more than 100 partners locally to create Eat Fit NOLA, a partnership that highlights the better for you items right there on our restaurant's menu or on grocery store shelves, making it effortless for you to dine at your favorite restaurant or shop your favorite market without ditching your otherwise healthy diet. Every month, Community Health Heroes Show, which is sponsored by the United Health Foundation, will shine a spotlight on an incredible chef to help show you how you can make smarter food choices to live a healthier, happier, and hopefully longer life. In addition to Eat Fit NOLA, you can find our partners such as Eat Fit North Shore, Eat Fit BR, Eat Fit Bayou, and coming soon, Eat Fit Acadiana in a neighborhood near you. So don't go away. Community Health Heroes will be right back.
Best Pizza and Best Restaurant That Delivers. Those are just two of the best of titles Reginelli's Pizzas received over the years. And if you take a look at their new menu, you'll see some new Eat Fit approved items in between the many popular appetizers, salads, sandwiches, baked pastas, and hand-tossed and custom-made pizzas. With us today is the owner of Reginelli, Chef Darryl Reginelli, and operations manager Adam Carey. And they're here to prepare their fresh strawberry field salad. And of course, Eat Fit NOLA ambassador Lauren Hewland is also joining us. She's going to be talking about the new Eat Fit items at Reginelli's and why eating strawberries this time of year is a healthy and nutritious treat. Thank you all so much. I don't even know if anyone's watching us because they'll probably be all watching this. This is a beautiful display of all the wonderful food you brought today.
Well, thank you. That was a wonderful introduction.
Oh, my pleasure.
That.
We're so glad to have you here. The salad that you're going to prepare, tell us what exactly it is and what's in it.
So the strawberry field salad is going to be on mixed greens. Obviously, it's fresh Louisiana strawberries.
They look beautiful.
Yeah, they look great this time of year. This year, the batch has been particularly sweet too, so it's perfect for our purposes. It's got some prosciutto ribbons, burrata, candied pecans, and of course our homemade strawberry dressing, which is really sweet, nice, but also has a little bit of tart to it to make sure.
Citrus and everything added in there, and but we'll go ahead and we'll put all that together for you and start.
Yeah, and start showing us how to put together. Okay. And Lauren, when you can, tell us a little about strawberries this time of year. Why they're so healthy for us, especially because they're in season.
Absolutely. Reginelli's just added this on their menu. Strawberries are really great. They have a lot of vitamin C and they're sweet. So you always want to try to, instead of doing all the added sugar, go with natural sugar. You get tons of vitamins, minerals, and little electrolytes to just help keep us hydrated, and you get that sweet treat as well.
And once you cut up these bad boys, what do you do with them?
You're cutting them up just to make sure that they can blend easier in your food processor. So I quartered them.
They smell sweet and yummy.
Oh, they're great. So I'm gonna put the rest in.
And how many strawberries should you, if you're making this at home?
If you're doing this at home, you want about a pound. You know, in the restaurant, we sometimes go a little bit larger because we're gonna do bigger batches, but you're doing about a pound.
But go ahead and we'll add a few of
some fresh orange juice.
Items.
Very nice.
And something about Reginelli's that I love is that they make all of their dressings in-house. So sometimes with dressings, you know, it can be hard because when you get store-bought, you really need to look at the nutrition facts label because a lot of times they have a lot of added sugar and added sodium, which you don't need all that salt.
You can pretend you're doing such a good job at lunch eating a salad with the wrong type of dressing. Forget it, right?
Exactly.
Like the sweetness in this comes from the honey. It's natural, so we're, you're not putting anything into it.
This is going to be delicious. You have honey, strawberries, oranges,
balsamic vinegar, and some lemon juice also, just for a little tartness.
Everything looks so great.
And then you're just going to finish it up with just a little bit of salt and pepper just to add that seasoning.
You know, the Eat Fit program, we've been doing it for about 5 years now, and it has kind of changed a little bit of the direction of how we think when we're developing items. So it's been a healthy partnership.
Absolutely.
I guess that's what you're looking for. So, I mean, yes, it's been a healthy partnership, and it has had us really rethink about like when we develop menu items and all.
So the last bit was olive oil, just to thicken it up a little bit.
So you would really emulsify it all, and it comes out to this really creamy puree that's emulsified.
Looks fantastic.
So we'll go ahead and put all the
So you recommend
together?
when you do blend it for a couple minutes until it gets to be that consistency?
You want to run it till it has this consistency.
That looks great. And that's the official dressing for the salad?
Yes.
And what greens do you usually use?
We use mixed greens on the salad. So
like a field green
mix?
mix?
Yeah, field greens.
That looks lovely.
You can find it at any grocery store. And so for Eat Fit, some of the, to make sure that it meets all the proper requirements, we're not really loading on a bunch of dressing. We're making sure that it's, meets the requirements. So this is going to be about, 1 ounce, just to make sure it coats lightly, you get it, but again, this doesn't really, smother it.
Yeah, absolutely.
It looks like it could be a good dipping sauce too, doesn't it?
Oh, yeah.
It does, it does.
You can put it on ice cream, anything.
And a lot of times the dressing, some people just overdo it, but really you just want to lightly coat, and then you can actually taste all the different flavors that are going in there.
I gotcha. And you were talking, Darryl, about Eat Fit. I can only imagine with the popularity of the program that there's actually demand for it. I'm sure you've had customers come in say, do you have any Eat Fit approved items?
Oh, absolutely. Now, I believe we have 8 Eat Fit approved items of menu items that can be either altered or ones that are just on the menu that are Eat Fit approved.
Talk about a healthy portion. This looks like a salad you need to take home as well. You put a couple of extra things on top of it?
Yeah, we have ribbons of prosciutto. He put in some more the strawberries and the lettuce that was tossed in the dressing. And then here we're going to add the toppings to it, which is candied pecans, just a little bit of candied pecans in there that add a little nice crunch, and that little sweet and sour kind of combination going with the dressing, a little salt and pepper on top of the burrata.
Wow.
And we have it.
Darryl, and I can't let you all go without telling us a little about this guy over here. I hear Reginelli's has this reserve collection, 3 types of wine, that you actually created this product line with Commander's Palace. How did that even happen?
Well, Dan Davis is the wine guy at Commander's, and he's very highly known throughout the industry and well respected, all kinds of awards, and he put together a fantastic cellar for them. T. Martin offered his services to us, and he got us in connection with this winery, and we do our own private labeling, design all the labels, a couple of different labels for each of the vintages, and it's really been a fantastic thing. The wine drinks very easily, and it's great pizza wine, but Eat Fit approved, I believe. So I think everything in moderation. But yes, we're really happy and excited about the wine.
Well, I mean, you have 8 locations in New Orleans, 1 in Baton Rouge. When you started this Reginelli's empire, did you ever think you'd also have your own line of wine? I mean, that's pretty impressive.
No, the only thing left to do now is go squash the grapes. I would love to run around and
we'll have you on for another show to do shows that do that, just that. Quickly tell us how people can find out more about Reginelli's.
You can go to reginellis.com. Reginelli's is on Instagram, Facebook. We have a Twitter account, and we're active all the time, so come on.
And
order online too.
Order online. When you go on your website, that's all you see. Easy ways to order online.
Yeah, it's really
And Lauren, tell us about Eat Fit NOLA. How can people find out more about that?
Absolutely. So eatfitnola.com, and then we also have a free Eat Fit app that has all the nutrition facts for everything you see on here.
And we're also going to be posting some recipes on our Facebook page and at communityhealthheroes.org. Thank you all so much. This display was wonderful. The demonstration was great, and it smells delicious. And I have a feeling a lot of people want to take a bite of this in just a few moments. We'll be right back.
If you smoked, this new lung cancer screening could save your life. Visit SaveByTheScan.org.
Thank you for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurants, please visit our Facebook page or email us at communityhealthheroes@gmail.com. If you'd like to learn more about our guests and share segments from our show, check out our website at communityhealthheroes.org, and you can also find our show on YouTube. We hope the information we've provided you about the Urban League of Louisiana's 4-part empowerment series, Get Well Now, what UnitedHealthcare is doing to confront the opioid epidemic, the new partnership between UnitedHealthcare and SmileDirectClub, and how to prepare Reginelli's Strawberry Fields Salad will help you and your family live healthier, happier, and longer lives. I'm Leslie Snedowski. Make sure to join us next time for more Community Health Heroes.